Okay, so now we're going to move on to types of medication questions. Types of medication questions. So when it comes to the types of questions, the questions will often test you with side effect related answer choices. So where the choices are actually the side effects, and that's why I said you have to know the two side effects. And then also the other type of questions is dosage calculation questions. These are typically how the exam will test you when it comes to pharmacology. And one thing I'll say too is that pharmacology, as far as the NCLEX RN exam, it usually covers about 14% of the exam, and which is actually pretty high. So that's why it's important to know the pharmacology well. A lot of nurses say that that's their weakest area, so it's important to know the pharmacology well. So like I said, you must study at least two side effects, not just one. And then you should start to learn what is the intervention of that side effect. You should, when you think of the rationale and the side effects, okay, what would I do if that happened, right? What would I do if that happened? So for example, when you look at drugs, where it lowers the electrolyte value, you need to know the appropriate intervention and whether, for example, you would intervene it with maybe food, diet, or maybe a drug. So let's say, for example, one EKG rhythm that you should also know is torsades de pointes. Torsades de pointes, which is associated with hypomagnesium, which is where the magnesium level is low. Once again, you should know what the normal magnesium levels are too when you're preparing for your exam. So if it's the magnesium, if they're having hypomagnesium, then the appropriate intervention for that is to give magnesium. That is the intervention. Is to give magnesium. So sometimes it will be food, sometimes it will be another drug. So it's important for you to understand that when it comes to the interventions with the side effects. And some side effects may be related to food interactions. We're going to cover that right now, what I mean by this. So, as we mentioned earlier, Lasix. So what does Lasix do? And the other name was furosemide. So Lasix, it causes the patients to lose potassium, right? It causes them to lose potassium. So therefore, you need to know what food replaces potassium. Because I'm telling you, the exam, it doesn't, one thing you'll realize about hopefully, that you'll realize about the exam is that it doesn't give you, I don't want to use the word tools, it doesn't give you the details. It assumes that you know the details. And that's why, a lot of nurses get thrown off because they weren't expecting how specific it would test them. And this is what I mean by this. I'll show though as we move along. But so you need to know what food replaces potassium. So here are the foods that replace potassium, and make sure you know this. Also, when you you may get questions where it will ask or it will mention like food trays. What's on your patient's food trays. You need to identify what food sources are on there that may be rich in potassium or low or whatever it is. So the first one, cantaloupes, very high source of potassium. Very high source of potassium. Next one are lentils. Lentils. That's also really good source of potassium. Bananas. And bananas is, bananas for me, even people who aren't nurses know that bananas are high in potassium. So I usually tell people, make sure you know other sources like the ones I mentioned right now, because the exam most often is not going to give you bananas. Like it's not, it's not going to make it that easy. So, but bananas are a high source of potassium.